Instead of a sick of the week this week, we are ending on a particularly befuddling what the health. RFK Jr. has suggested that poultry farms simply let bird flu pass through the flocks rather than culling the flock as soon as an infection is detected. So I want to take some time to talk about the various reasons that this is a really bad idea. First of all, it's being proposed under the guise of biosafety. The Deputy Secretary of HHS said that it is to protect people who would be doing the culling from bird flu. But my questions are, who is going to take care of millions of sick birds on a farm? Who is going to pick up all of the bodies of the birds that die from infections? Who is going to clean the massive amounts of infected feces which spread the disease? Allowing the virus to infect millions of birds instead of just a few hundred is going to put farm workers at a significantly greater risk. So that argument does not sit well with me. Secondly, I assume the idea is that you'd be left with chickens that have immunity, and then you get to herd immunity. But bird flu kills the vast majority of chickens that it infects. And industrial farming means that there is not a ton of genetic variation among flocks. So it's not likely that a big portion of them will have resistant genes. Also, we have no idea if birds that do survive would be healthy or would be immune to future infections. And third, it would be devastating for farmers. They get reimbursed for the birds that they have to kill, and then they have to clean and pass inspections before they can get more birds. So waiting for all of the birds to be infected will shut down their operations for a lot longer. And lastly, the reason that we are in such a bad situation with bird flu is because it has been allowed to spread so much. Every infection is an opportunity to acquire a mutation that we don't want. The spread within wild birds is what created mutations that made it infectious and lethal to a lot of mammals. It made it more able to infect cows, which has resulted in more human infections. So it doesn't make sense to let it spread from a safety standpoint, an economic standpoint, a virology standpoint, or an ethical standpoint. But other than that, great idea.